From Press Communications LLC, this is Jersey Shore Matters with Dianne DeOliveira.
It has been 5 months since the COVID-19 pandemic first impacted New Jersey, and many of us are struggling emotionally and mentally to cope with our new reality. Hi, I'm Dianne DeOliveira, and joining me this morning to help us cope with some of our stresses and fears is Aubrey Hunt, the Division Director of Mental Health Services at CPC Behavioral Health. Thank you so much, Aubrey, for taking the time to discuss this important topic.
Absolutely. Thank you for having me.
So every aspect of our lives is now impacted by COVID-19. The attitude I'm sensing is we're over it already. You know, we're burned out, and it doesn't appear to be going away anytime soon. The job aspect alone can be really tough. I know several frontline workers who, obviously it's more difficult for them. And if we do get a second wave, I hear so many of them saying they don't know how they're going to make it just because they're so burnt out. For that type of line of work, how do you help people cope with that? That's day in and day out that they have to see this.
Absolutely. We really try to encourage our staff and the frontline workers that we work with to start to reincorporate some healthy coping strategies that they may have had before the pandemic. I think we were all in kind of crisis mode initially. We just tried to find the best way to cope at that time. But now we're starting to have to acclimate to a new normal. And how do we do that? And really, it's about starting to do the things that we enjoy again and try to come out of social isolation. Just because we're isolated from each other physically doesn't mean we have to be isolated emotionally. So really trying to have people start to re-engage with their healthy, coping mechanisms, whether it's exercise, eating healthy, monitoring their sleep patterns. That's really the most important thing for all frontline workers, but really for everybody.
So should we be focusing on self-care first then?
Yeah, absolutely. Because, my thought is that if my tank is not full, I'm not going to be able to help others. So trying to, I think of the analogy of, putting your mask on when you enter, if something's happening on an airplane. If you don't put yours on first, you're not going to be able to help the person next to you. So really focusing on your own self-care is very important to be able to give back or help others or be able to function in other capacities, whether it's at work, with family, and other, areas of your life.
The other thing is so many people are returning to work. Some people are still working from home. And all of those have their own stress in itself. I've been isolated for 5 months, working from my home studio while my partner is in the studio working. So we haven't seen each other. And then we also have people who are just working from their home and those who are being called back to the office who may be a little bit fearful of going back into work. What kind of advice do you have, or what do you tell people in that situation, dealing with isolation and then dealing with fears of returning to the workplace?
Actually, we as an agency are kind of going through this as well. And we had a lot of people working from home. Everybody kind of got used to the day-to-day of that. And now as people are starting to migrate back to the offices, there is a lot of fear involved in that. And just, trying to ensure that, we need to remain safe. We need to wear masks. We need to social distance. We need to, follow the proper CDC guidelines. But, there's also an emotional toll. Just when we kind of got used to working at home and started to develop a routine, now we're starting to reintegrate back into the office. So that can be disruptive as well. So I think just being patient with yourself and being patient with those around you is really important. I think now's the time where we really need to be kind to each other. The stress of this pandemic has caused all kinds of physical, emotional, behavioral challenges. And I think we just really need to just be gentle and just try to be safe and follow the guidelines and, try to be supportive of each other.
One of the things it's kind of interesting too is we're such creatures of habit. Even though we're living in new times now, it's still, you don't always remember your mask, or you forget to put it up, take it down. We have one-way aisles. It's just remembering the little things, always remembering, be careful when you're handing something, or not to reach out and touch someone. I was at a gathering recently where I hadn't seen someone, and they immediately ran up to me and hugged me, and I froze for a second because I haven't even hugged my own parents, so it caught me off guard. And just little things like that we take for granted, that we're not thinking of every day. What for people who are dealing with anxiety, or still just, having a hard time getting through this, is there anything in particular advice that you give or you work through? Or what are some signs of emotional burnout from all of this?
So obviously some signs, you will start to have some behavioral signs. If you start to feel very short-tempered, you have a difficulty, focusing, some physical symptoms that happen are, difficulty sleeping, changes in eating habits. If you notice that you're, kind of hypervigilant and always on edge. And, I think even the most mentally healthy, fit people prior to COVID are struggling now. So if you were predisposed, or you had, maybe healthy anxiety in your life, healthy anxiety can be really, a wonderful thing to help you accomplish things, help you achieve goals. But, if that healthy anxiety is kind of turned into a problem situation where you are having difficulty, or, disengaging, isolating even more, you're not able to accomplish tasks, your lack of sleep, all of these things will kind of trickle down. I really think that, what I've noticed in the community is people just being very short-tempered with each other. And you mentioned
Yes.
the hugging, or, people asking other people to wear masks. I think we just, again, goes back to just be kind, follow the golden rule. Everybody's uncomfortable. Everybody's not really mentally or physically prepared for what's going on. And we have to just kind of respect each other's boundaries. And I agree with you. I haven't been able to visit my family either, because they all live in states that are under quarantine.
Sure.
So I would have to quarantine when I return. So I think that whether you're a therapist, or whether you're a frontline worker, or whether you work in, the communications industry, it doesn't really matter. We're all being affected in all kinds of different ways, both mentally, physically, emotionally.
I just want to remind our listeners, if you're just tuning in, I'm Dianne DeOliveira, and joining me this morning is Aubrey Hunt. She is the Division Director of Mental Health Services at CPC Behavioral Health. And we're just discussing COVID-19, burnout, anxiety, stress, fear, all of that. Another big thing that I wanted to bring up, and so many parents are really stressed out beyond, because the school issue. So many districts, there's so many unknowns right now. Some districts that are smaller are planning to have kids go in 5 days a week. There's hybrid plans where there's, 2 days on in school, and then the rest is remote learning. Some schools are doing all remote learning. And of course, Governor Phil Murphy is giving parents the choice of all remote learning. Of course, this will probably all change in a few weeks, depending on what happens, if the number of COVID cases continues to go up, or the rate of transmission. But what about for that type of anxiety, and just, and parents who are afraid to send their kids to school? They want to, but they're also worried maybe they have underlying health issues that they don't want to be exposed, but they want their kids to go to school. It's a very it's trying times right now for a lot of people. And if you're a working parent, whether, you have to stay home, how do you teach your kid at home if you have to be in work, if you're not working from home? So all those things can make you crazy.
Absolutely. I can't, being a parent in this time is just, there's so many factors that are just very overwhelming. And, I really do feel for our children who, are kind of probably unsure of what's happening. I think the best thing that we can do is just try to be flexible. Now, as someone who's very regimented and scheduled, I live by my schedule. That has been one of the most overwhelming things for me to overcome during this time, is not having that structure. But doing the best we can to provide structure for our children and provide structure for ourselves and model good behavior. our children kind of feed off of our anxieties and trying to do our best to not, relay that excessive worry. But of course, each parent has to make their own choices about what's best for their children. It's a very anxiety-producing time. I like to hear, we do have a school associated with our agency, and I really like to hear some of the things that they're incorporating to try to keep people safe. It's a very unsure time, and I understand both sides of it. We want the children to go back to school, because teaching at home, we found out, was not always the best thing, but at the same time, that might be putting them at risk or their family members at risk who have underlying health conditions. So really trying to find a way to talk about this. And if you're not able to kind of reassure your children, or you're not able to reassure them, and you are having some of this excessive worry, is trying to reach out for maybe professional help.
Now, what about our mindsets and approaching this and trying to take a different type of attitude in everyday life, whether it's, going into the workplace, sending your kid off to school? Is there a certain mindset we should try to, is there any types of things we can do to try to relax a little and not be so stressed out?
We have lots of, tools that we've been using with our clients, and with, as an agency with each other. There's all kinds of apps that you can try to help you use, but also, having this mindset that this will end. And we need to focus on resiliency now, and have that mindset that, things will get better. We will make it through this. We are adaptable humans, and, trying to kind of have that mindset of not doom and gloom, and focus more on positive. What are the positive areas of your life? And I think that sometimes coming up with, the gratitudes of the daily life kind of helps you get into that mindset of, what is going well, as opposed to all the things that are kind of going wrong.
What any other advice or anything that we left out that you would like to cover, Aubrey? We have a couple of minutes left before I want to make sure you're able to, get your information out there.
I just think that, during this time, we've seen such a huge uptick in all kinds of addictive behaviors and mental health issues. Whether it's the isolation of being at home and trying to fill that void through substances, whether it's alcohol and drugs, shopping, food, and also, mental health. Again, I mentioned before that even the most mentally healthy people going into this, time are struggling, let alone the folks that are already isolated, already struggling. So I definitely encourage people to, check on your neighbors, check in with yourself, check in with your friends and your family, because, we are seeing such a huge escalation in all of these issues. And, again, people who, never had any signs of symptoms of these things before or did, are really struggling and suffering. So I think, and that is also helpful for us, is to start to focus on others and, less focus on ourselves and more focus on others. It's a fine balance, learning how to, do for others and check in with others, but also maintaining our own self-care, which is kind of what we do for a living in the behavioral health field. So, all I can say is just really check in with yourself, really check in with others. And, there's so many services out there for help if you're really struggling.
What I think too, Aubrey, is interesting is just in speaking with friends and colleagues, I feel like, we all went into this, and after like 2 months in, you start to get a little crazy. Now it's 5 months in. I feel like it's a roller coaster. I feel like there's days where, and other people have expressed the same thing, where you have good days, and then there's days where you are just like, you're ready to pull your hair out. But we're all in this together. So I guess we have to just ride it out. And like you said, try to stay positive, get help if you think you need it. I'd like you to give out a website and phone number, if you could, for people who want more information or help, if whether they're struggling themselves or they know someone who is.
Absolutely. CPC Behavioral, Health has a multitude of different services available. We are located all over Monmouth County and even have offices that are easily accessible, by either Middlesex and or Ocean County. Our access number is 1-800-250-5688. 9811. And we also have our CPC behavioral.org website. So you can access any kind of information. Again, we service adults, children, adolescents, groups, anything, that you can really think of. We usually try to, addictions, again, another big piece of something that we're seeing right now. So please reach out.
Aubrey Hunt, the Division Director of Mental Health Services at CPC Behavioral Health. Thank you again so much, and please stay safe.
Absolutely. Thank you. You too.
You can hear Jersey Shore Matters with Dianne DeOliveira every Sunday morning on Press Communications LLC.